10 symptoms of pancreatic cancer that will shock you. There is a reason doctors call pancreatic cancer one of the most dangerous cancers in the world. It is not because it is the most common. It is because by the time most people find out they have it, the cancer has already spread. Pancreatic cancer is often called a silent disease. In its early stages, it rarely produces any noticeable symptoms. And when symptoms do finally appear, they are subtle, vague, and easily mistaken for something far less serious. Here is what makes this cancer so deceptive. The pancreas sits deep inside the abdomen, tucked behind the stomach and in front of the spine. Because of this hidden position, a tumor can grow on the pancreas for years without causing any pressure, pain, or obvious signs of illness. That means a patient can feel perfectly fine while a tumor is quietly growing. And that means a doctor can miss it too, even during routine checkups. This is not a failure of medicine. It is the nature of this particular cancer. By the time most people receive a diagnosis, the cancer has already reached stage 3 or stage 4. At that point, treatment options become limited and survival rates drop significantly. The 5-year survival rate for pancreatic cancer remains among the lowest of all major cancers. But here is the important part. There are warning signs. They may be subtle, they may seem unrelated, but they do exist. And knowing what to look for could be the difference between catching it early and catching it too late. In this video, we are going to walk through 10 specific symptoms of pancreatic cancer that everyone should know about. Some of these will surprise you. Let us get started. Disclaimer: this video is for educational purposes only and is not intended as medical advice. Always consult a qualified healthcare professional for guidance regarding any medical concerns, diagnoses, or treatment options. All information provided is the result of careful research and verification. For full source details, please refer to the video description. 1. Jaundice. The first symptom on our list is jaundice, and it is one of the most recognizable warning signs of pancreatic cancer. Jaundice is a yellowing of the skin and the whites of the eyes. It happens when a substance called bilirubin builds up in the blood. Bilirubin is a yellow-brown chemical found in bile, which is a fluid produced by the liver to help digest fats. Normally, bile travels from the liver through the common bile duct, passes through the head of the pancreas, and empties into the small intestine. When everything works correctly, bilirubin is processed and eliminated from the body without any issue. But when a tumor develops in the head of the pancreas, it can press directly on the common bile duct. This pressure blocks the flow of bile, and bilirubin starts accumulating in the bloodstream. That buildup is what causes the skin and eyes to turn yellow. Here is something important to understand. Cancers that start in the head of the pancreas are located right next to the common bile duct. Because of this proximity, even relatively small tumors can obstruct bile flow and trigger jaundice early on. This actually presents a rare opportunity. Jaundice caused by a tumor in the head of the pancreas can sometimes lead to an earlier diagnosis compared to tumors in the body or tail, which tend to grow undetected for much longer. Jaundice from pancreatic cancer does not come alone. It often arrives with dark-colored urine that may appear brown or cola-colored. Stools may become pale, greasy, or clay-colored because bile is no longer reaching the intestines. These changes in urine and stool color are directly tied to the bile duct obstruction and should never be ignored. 2. Abdominal or back pain. The second symptom is pain in the abdomen or back, and it is one of the most common complaints reported by people diagnosed with pancreatic cancer. This pain is not random. It is directly connected to where the tumor is growing and what structures it is pressing against. Cancers that develop in the body or tail of the pancreas tend to grow larger before they are detected. As these tumors expand, they begin pressing on surrounding organs, including the stomach, the spleen, and the large intestine. That compression creates a deep, persistent ache in the upper abdomen. But the pain does not always stay in the front of the body. The pancreas sits right in front of the spine, and a network of nerves surrounds it. As the tumor grows or spreads, it can invade these nerve bundles, sending pain signals directly to the middle or upper back. Many patients describe this as a dull, gnawing pain that seems to wrap around from the abdomen to the back. It often worsens after eating because digestion increases blood flow and activity around the pancreas. Lying down flat can also intensify the discomfort because gravity shifts the position of the tumor against the spine and surrounding nerves. Some people find temporary relief by leaning forward or curling into a fetal position. This positional pattern is actually a clinical clue that doctors recognize. If you are experiencing unexplained upper abdominal pain that radiates to your back and gets worse after meals or at night, do not write it off as a pulled muscle or a stomach issue. This type of pain deserves medical investigation, especially when it persists for more than a few weeks. 3. Unexplained weight loss. The third symptom is unexplained weight loss, and this one catches many people off guard. Losing a few pounds might seem like a welcome change at first, but when weight drops rapidly without any change in diet or exercise, it is a red flag that something is happening inside the body. Pancreatic cancer disrupts the way your body processes nutrients at a fundamental level. The pancreas produces